All right, good afternoon, everyone. I'm San Francisco Mayor London Breed, and I'm joined today by the Director of the Department of Public Health, Dr. Grant Colfax, the Director of the Department of Emergency Management, Mary Ellen Carroll, the Director of the Department of Human Services, Trent Rohr, the Director of the Department of Homelessness and Housing, Abigail Stewart-Kahn, and our Police Chief, Bill Scott. I want to thank you all so much for joining us here today, and we are providing our update to begin the week. As of today, we have 1,424 cases of people who have been diagnosed with the coronavirus, and sadly, there are 23 people that have lost their lives. And currently we have about 85 people who are hospitalized. If you would like more information specifically around the people who have been diagnosed as it relates to their race, ethnicity, zip code, or any other data, please check out datasf.org/COVID-19 for more information. We update that tracker every day by 9 a.m. Today, I just want to start by, again, thanking you all here in San Francisco for your cooperation. I know that it has not been easy. We've imposed restrictions to your lives that have made things not only very difficult for you, but difficult for your family. Sometimes difficult for not just your physical well-being, but also your mental well-being. We have tried to make sure that in this process, as we are trying to protect public health, we don't create an even worse problem with a number of those sorts of challenges related to mental health, related to economic health of your household, and those other matters. It has been probably, I'm sure, for some of you, the most challenging time of your lives. And I know that some of the assistance and programs that we've offered from the city may have been helpful, but it's definitely nothing like getting back to work and earning your own income and being able to take care of your family. There is nothing like that, and we want to make sure that we are able to get back to that. But more importantly, we have to make sure that we are able to continue to keep people safe. This has been pretty much the most difficult thing I've had to do, is to ask the people of this city to basically stay at home and only leave your house for essential services, or if you're an essential worker, or to get fresh air and exercise. I've asked you to do that through a deadline with the hopes of maybe moving back to allowing the city to open, and today, unfortunately, we will need to extend the deadline for the stay-at-home order through the month of May. And I know that this is, again, very challenging. It's been very challenging for me personally. In addition to, of course, the responsibilities of mayor and making sure that I am informed and making good decisions on behalf of the people of this city, I also have to I have to take care of myself as well. And in fact, being in the house all the time and not being able to visit with my friends and my family, and that's been very challenging. I wasn't going to tell anyone this publicly, but I had a moment this weekend, and I started playing music that I grew up to, and I started dancing by myself and singing the words of songs that I hadn't heard in years. It really did make me feel good. It made me feel alive. It made me feel hopeful that there is a light at the end of this tunnel. And I know that so many of you are looking at ways in which you can also continue to use this as an opportunity to make sure that you are taking this time for granted in ways that continue the positivity, the goodness, and that you're able to get yourselves and your families through this time. It has already been very difficult, I'm sure, for many of you, especially kids who cannot play with their friends, or a lot of the seniors who are graduating high school, the kids who want to go to the parks, not being able to see your grandma or grandpa. I can't even imagine just how challenging I'm sure this has been for so many of you. And again, I want you to know that we realize these are real challenges. And as we extend this stay-at-home order, it is going to be important for us to look at ways in which we can develop, along with our health experts, policies that will get us back to plans in order to open our city again. And let me just be clear that public health is our priority. Taking the data and the information from our public health experts and using that to make determinations around what we can and can't do is critical to making sure that we're protected. But we also need to prepare. And as I mentioned to you all last week, our Economic Recovery Task Force has already started meeting. The goal is to provide recommendations because when the city does open, there is going to be a change. There's going to be a change with restaurants. There's going to be a change with hair salons and nail salons and various job opportunities. There's going to be a real change with large-scale events. There's a lot of uncertainty because right now what we see are the numbers go up every single day in our city. We also see the number of hospitalizations. They have gone up in our city, and the good news is they've not gone up as large as other places because you all are doing your part to comply. But the fact is they are still going up. So we are not out of the woods yet. And so we want to be very careful that we not take the steps out of frustration, out of concern. We don't move too quickly and repeat mistakes that have been made in our past history. About 100 years ago, I brought up the last time the Spanish flu, when we thought the worst had passed us, and folks threw off their mask and went out into the streets and partied and had a good time, and a few days later, we were even worse off than when we started. We don't want that to happen in our city. This is not an easy thing to do, and to continue to come to every press conference and not only thank you for what you've done, but to ask you to do more. This has been very difficult to do because as hard as I know it's been for me, I'm sure it is so much harder for all of you. And I just want to continue to express my gratitude because the only reason why the numbers are not as bad as they could be has everything to do with so many of you. And your patience and your understanding has been really the guiding light in what has been a very, very challenging situation. So I just want to appreciate that, express that there are the deadline for the stay-at-home order has been extended through May, and we are hopeful that through this Economic Recovery Task Force and some of the other things that we are doing with our public health officials, we will be able to come back to you with good news about things that we will be able to do to make things easier for you in this situation. And speaking of good things that we are able to do as a city, after examining what we know people are interested in our Safe Streets program and closing off streets and allowing people to socially distance easier and safely, That program has been successful, and closing JFK Drive on the weekends has been successful. And after our review of JFK Drive and the fact that people over the weekends are basically definitely complying in most instances with the order, following the direction, we think it's only it's only fair to offer JFK Drive to close that street effective 6 a.m. Permanently through the course of this stay-at-home order. And I want to be clear, after this stay-at-home order has expired, that will no longer be the case. But in the meantime, in an effort to provide more space for people to move around and maybe get some exercise and to run and to bike, we wanted to do something that would help. We don't want people driving to the park still. We want people walking through their neighborhoods and to their neighborhood parks. We don't want people setting up picnics or play dates or the things we talked about. We still need you to socially distance yourselves from people out in the park and to stay 6 feet apart. That is so critical, because we're going to close JFK Drive and we're going to close Shelley Drive in McLaren Park to car traffic as a way to provide more space for more people to move around, because we know that there are larger populations using these parks in these areas, and it gives you an opportunity to move around safely. And that's what this is about. And so we hope that this new opportunity, this new adjustment will make this additional extension of time to stay at home a lot more easier for each and every one of you. So again, thank you for your cooperation. I want to talk a little bit about what's happening with rent collection for tenants that are tenants with the City and County of San Francisco. And as some of you are aware, a moratorium on residential and commercial evictions has been moved forward through an executive directive by my office. We've extended that to ensure that as this pandemic continues and people are unable to get back to work in a timely manner, we are able to make sure that no one is evicted because of what's happening with COVID-19 to each and every one of us. That doesn't mean that if you can pay rent and you are able and you are still getting paid, I mean, that does not mean that you should stop paying your rent, but there are so many people out there who are in a situation where they have a space that they lease and they're not generating any revenue whatsoever because they are not an essential business. And as a result, they cannot pay their rent or other bills for this space. Our goal is to make sure that when our city reopens, we want our economy to, of course, get going sooner rather than later. And what that means is making sure that we're not losing all of our businesses, our small businesses, our medium-sized businesses, that they are able to come back to work on day one with the new guidelines and get started right away without the fear of being evicted. So we've done this with the city already, with the city tenants in particular, and we're asking our enterprise departments, and they are seriously considering, and I'm sure are going to move in this direction. In fact, the Port of San Francisco will be moving this week in that direction with their clients, the people who occupy a number of real estate along the port. They will get some relief soon, as well as the airport and other enterprise departments in the city where there's an opportunity to hold off on rent collection and to work with our tenants. That is something that we need to do because even when we reopen the city with new guidelines, financially it's still going to be challenging. Tourism, our number one industry where a lot of revenue is generated for the city, it's not going to just return overnight. So we are all facing very similar challenges, and so it's important that we provide tools that will make it easier for us to face it together. So I want to thank the Port Commission. I know tomorrow night they'll be considering extending this policy, and it appears that they are very receptive of doing so. I want to also just take a moment to talk about some comments that I made on Friday around PPE. It has definitely been very frustrating. The fact that we knew that a crisis existed or was coming, and there was just a lack of coordination from the federal government to help prepare and get ready for what we knew was to come. There are a number of challenges that we still face around PPE, and we operated our Emergency Operations Center back in January of this year. It's April, almost May, and we're still having the same conversations around PPE. And while those challenges still exist, I want to point out some information that was not accurate that I stated at the last press conference regarding FEMA. In particular, the information we were given by one of our sources that we were purchasing PPE from, a third party, basically provided us that information when we had anticipated the PPE to come to our location. We were preparing to purchase it, and the excuse that we gave, which we were beyond frustrated with, was that these materials were diverted to someplace else and confiscated by FEMA. And as a result, that was, along with a number of other challenges that exist, that was one that I was particularly frustrated with, especially in light of the fact that we are working with FEMA on our hotels and on food delivery and a number of other things. This was just very frustrating. And we found out when the director of FEMA here in San Francisco reached out to our office to make it clear that not only was this not true, but they are now investigating the third party that we are working with to ensure that accurate information is provided. Providing the incorrect information is not only irresponsible, but it's also very dangerous in light of what we are all dealing with. And so not only do I want to apologize to FEMA for that particular information and providing inaccurate information, I want to also just point out that the other challenges that I talked about are still challenges that we face. And we will continue to do everything we can to work with FEMA and to work with other agencies to deliver the PPE our city so desperately needs. We are not out of the woods, and even if we have the PPE we need to help with our hospitals, maybe for this month and some of next month, we are going to be dealing with the coronavirus for some time. And so when we talk about not only the need for PPE to help with our hospitals, when we're thinking about restaurants, hair salons, and nail salons and other places opening, we have to make sure that when we are implementing regulations on their reopening around masks and other things that they may need, that we have access to those resources as well. So there's a larger conversation here in terms of resources, and there still continues to be a challenge with the coordination around the efforts for large cities like ours with our federal government. But I will take this opportunity again to thank FEMA for their willingness to be available to work with us to ensure that some of the obstacles that we've had with accessing PPE that we are purchasing, that those obstacles are removed. They have extended that support, and I appreciate it, and we desperately need it. So with that, thank you for the time, and at this time, I will ask Dr. Grant Colfax to come forward and provide an update. black to white after we scrub it down anymore.
Good afternoon. I am Dr. Grant Colfax, Director of Health. Thank you, Mayor Breed. A week from today is May 4th, which would mark the end of the Bay Area's current stay-at-home health order. I commend everyone who has done so much to make that intervention successful. We have indeed flattened the curve. We, each and every one of you, has literally saved lives. In San Francisco and the Bay Area as a whole, we have led the country in taking aggressive, early action to protect our communities from the threat of the coronavirus. I would like to remind you of a few key moments in our journey. On January 21st of this year, as we had watched closely the developments internationally with regard to the coronavirus, the San Francisco Department of Public Health activated its Department Operations Center. With that, we set as a top priority our preparation and response to the coronavirus. We devoted significant resources and staff to address the upcoming issue. A week later, on January 27th, the city opened its Emergency Operations Center, expanding and strengthening the effort of the city-wide response. At that time, we were monitoring incoming travelers from countries with confirmed cases and still had no cases in San Francisco. Yet, the mayor continued to heighten our preparedness. On February 25th, she declared a local emergency, even before we had any confirmed cases. This decision was pivotal, as it allowed us to move significantly faster in mobilizing the many aspects of our city's collective response. On March 5th, we had our first confirmed cases, as we had anticipated. And on March 11th, we made strong social distancing recommendations so that the public could understand how to help slow the spread of the disease. Slowing the spread has always been our goal. Later, on March 16th, the entire Bay Area issued a shelter-in-place, also known as stay-home order, and over 7 million people joined together to protect the health and safety of our region. That health order was renewed on March 31st, and the work that all San Franciscans and Bay Area residents have done has been a model for the nation. We are also following and are aligned with the governor's statewide stay-home order and the framework he has laid out for the state's recovery. We are fortunate and grateful that our state leadership is so focused on protecting public health, leveraging resources, and following the data, science, and facts. And yet, at this time, none of us can get complacent. We need to stand our ground and maintain our gains. Make no mistake, this virus is still out there, and it is still a threat. Today, there are 1,424 San Francisco residents with confirmed cases of COVID-19. A total of 23 San Franciscans have died from the disease, and my condolences to their families and friends. Of the 1,424 people diagnosed with COVID-19, 134, or approximately 9%, are people experiencing homelessness. For these residents, for other vulnerable populations, and indeed for our entire community, we must continue to have a unified regional approach. That is why, as the mayor announced, the Bay Area is going to extend the stay-at-home order through May. I know that this is very hard to do. We are missing vital and important parts of our lives. We are sacrificing time with our families, our friends, coworkers, and neighbors. Thank you for your sacrifice, your patience, your collaboration, and your support. As we think to the future and consider loosening some restrictions, I cannot stress enough that it will become even more important to continue to protect one another. This means establishing and sticking to what will be the new normal. This will include staying 6 feet apart, covering our faces, washing our hands frequently, and still staying home as much as possible. These actions are based in science, data, and facts. And they are working. And they need to keep working as we move forward. As we have done throughout our response, we will be informed by the data. We know we need to continue to expand testing and learn more about where cases are. And we know we will find more cases that way. Right now, we need to increase the number of tests being done in San Francisco each day. With ongoing expansion, this will happen. In terms of recovery, another key metric we will be watching closely is hospitalization of COVID-positive patients. Now, why is that? Well, that data point tells us a lot. It tells us how many people we have in our system who are seriously ill with COVID-19 and who need the highest level of care in the healthcare system. That number has varied somewhat over the past 2 weeks, from 94 patients on April 11th to 85 on April 25th. But the overall pattern has been pretty stable, a flat curve. That means that today, our hospital system has room to care for patients. And that is indeed good news. But it is still not enough. We need numbers to start dropping significantly and to stay down for several weeks. If that could happen if we continue on our current course. Yet we know today that those numbers could also start climbing again. That could happen if people stop taking precautions, stop abiding by health orders, and give the virus an opportunity to flourish and spread. As the mayor has mentioned, we saw that 102 years ago in San Francisco's prior serious flu pandemic. We have seen this happen with COVID-19 internationally in countries that successfully flattened their curve, lifted restrictions too soon, and the virus, unfortunately, came roaring back. The hospitalization numbers could also get worse if our vulnerable populations experience major outbreaks that we are not able to contain, leading to other people becoming seriously ill. And again, I thank you for your patience, your sacrifice, your collaboration, and support. And moving forward, we are working hard to develop recommendations based on data and science for loosening some of these restrictions. But we must be thoughtful, we must be careful, and we must take this step by step. With regard to our ongoing focus on vulnerable populations, they remain at the highest risk of the virus. This means people who are over 60 or with underlying health conditions. We must continue to prioritize them now and in the future, including people in congregate settings, such as long-term care facilities, in homeless shelters, SROs, and jail. And we are making considerable and significant progress. As an example, I remind you that over 850 people, 850 vulnerable people, including those experiencing homelessness, those with chronic conditions, or over age 60, are now in hotel rooms in our city to protect them from getting the virus, to protect them from getting sick, to protect them from potentially dying from the virus. We have made significant progress, but there is much more work to do as we learn about how to slow the spread. We must continue to generate new knowledge and support our response. For example, the health department is collaborating with UCSF and community members on a study in the Mission District to determine the prevalence of the coronavirus in one of the most densely populated sections of the city. This is in response to what we are seeing: high rates of infection in the Latino population. The goal of the study is to test thousands of people in just 4 days, and UCSF is well on its way, with over 1,700 people tested just this past weekend. What we will learn together will better inform our collective response and strengthen our current education, outreach, testing, and care efforts within the Latino community and the San Francisco community as a whole. Our goal remains to slow down the virus as much as possible. We cannot prevent it from coming here altogether, but we can, and we have, joined together to make it harder for the virus to spread. Later this week, the mayor and other Bay Area leaders will provide more details on what the new health order will entail. But in the meantime, I wish to thank you sincerely again for your cooperation and compassion. Every day, I see people wearing masks, standing apart from each other, and making the hard decisions. Together, we will do what it takes to get through this crisis. Thank you. Chief William Scott will make a few remarks.
Good afternoon, everyone. I'm Chief William Scott of the San Francisco Police Department. As I always start off, I'd like to thank our Mayor, London Breed, and our Director of Health, Dr. Grant Colfax, for their leadership during this very challenging time. As we expected over this past weekend, there were quite a few people out trying to get some exercise, fresh air, and enjoying the weather. We had an increased number of officers, volunteers with our ALERT program, which stands for Auxiliary Law Enforcement Response Team. We work with the park rangers and MTA ambassadors at popular public places to make sure and remind everyone about social distancing, about wearing face coverings, and really try to promote the safe protocols that our public health officials have told us will flatten the curve. And I'd like to thank everyone for their cooperation, because by and large, we've been very successful in getting compliance voluntarily from the people in San Francisco. So I would like to thank everyone for their compliance and for their cooperation. We did receive complaints over the weekend, not that many, but about the public health order violations. And in general, there were no significant issues. Surprisingly, we actually received very few complaints about the lack of face coverings. And although I can say, because I was out this weekend around the city, that most people were compliant. Most people tried to comply with the face coverings. There were people that did not have them, and again, we had our volunteers and our officers, our park rangers, our MTA ambassadors, who were trying to help the cause by actually giving people face coverings who didn't have them. And we think that's going to go a long way to continue to help flatten this curve, and we'll continue to do that. We've had to cite some businesses who, after being warned, continued to violate the order. And as of Sunday, April 26th, yesterday, that total is 17 sites in total. 8 of those were businesses that were cited, and 9 individuals were cited for violating either our county public health order or the state public health order. We've admonished warned a total of 78, and those warnings come with officers completing incident reports. Enforcement has been an option of last resort, and we have mainly gotten compliance when we've had to engage with individuals to remind them of the health orders. But as I stated, there are a few people and a few businesses who had to be cited. We will continue to use a progressive compliance pathway that starts with education, asking for voluntary compliance, warnings, and citations when necessary. You can visit our COVID-19 website on our San Francisco Police Department webpage and learn about our enforcement protocols. I'd like to remind everybody and take this opportunity to say, if you're going to go outside, please follow the public health order protocols. Remain 6 feet distance from others, wear your face coverings, and when you're waiting in line, please practice those social distancing procedures. Most of the businesses in the city have taken measures to remind people what 6 feet looks like. You'll see sidewalk markings. You'll see, in a lot of cases, employees of the businesses out in front of the businesses reminding people to wear their face coverings, reminding people to stay 6 feet apart from each other, and that has been very successful. And we'd like to also thank the businesses and the business owners and managers for working with us on that. I'd like to switch to crime now, and I'll provide you with an update on our crime statistics for this 6th week of the shelter-in-place order. I am happy to say that we saw a 19% decrease in overall violent crime this past week. That was 16 fewer violent crimes than the week prior. We saw a 24% decrease in property crimes this past week, which was 126 fewer property crimes from the week prior. And in total, there was a 23% decrease in Part 1 or serious crimes, which represents a 142 crime decrease over the previous week. And we're comparing the week of April 20th to April 26th to the week of April 13th through April 19th. We continue to investigate burglaries. The one area that we've seen a slight increase are burglaries, particularly commercial burglaries, and we continue to investigate, and we've made some significant progress on many of those investigations that have resulted in arrests and prosecutions from the district attorney's office. 27 of those cases have resulted in charges of, or booking charges of looting. And again, I would like to thank our district attorney and his team for working with us to add those looting charges of those type of crimes that were committed during a state of emergency. Next, I want to remind everyone that when you travel safely and responsibly, particularly on our roads and highways. As I reported this past week, We've had reports of a lot more speeding on our roads and highways, and that's simply unacceptable. Fewer cars on the road is not a green light to speed or break traffic laws. So with that, you will see our traffic company officers with an increased visibility on our high-injury traffic corridors in support of our focus on the 5 efforts. And then just to remind everyone, our focus on the 5 efforts is we are trying to get to 0 traffic fatalities by the year 2024. And that is our Vision Zero goal and aspiration, and we will be out to make sure that we remind people in whatever way we need to, whether that be education, enforcement, citations, to slow down. We want to thank those that are conducting their essential travel in a safe way. And as you see our officers out there, just to remind everyone, as we roll out our Slow Streets program, that it's imperative that you obey traffic laws, slow down, share the road with pedestrians and bicyclists, and keep a safe distance if you have to walk or bicycle on our roadways. As always, I want to encourage people to report crime when they see it, particularly violent crime. Report your crimes in a way that will decrease our face-to-face contact with either officers or each other and prevent the spread of the COVID-19 virus. As always, you can call 911. We will always be there for you to report crimes in progress, and particularly violent crimes in progress. If you need to, you can use our new Text 911 service. And again, I like to reemphasize that was really designed in mind with victims of domestic violence who sometimes aren't able to make those calls, those either landline calls or cell phone calls because of the circumstances that they're in. So please take advantage of the Text 911 service if you need to. For those crimes that have already happened and for nonviolent or property crimes, please call our non-emergency number at 415-553-0123, or you can call 311 or utilize our website to either request a report or to file a police report. And with that, again, I'd like to thank everyone for their cooperation up to this point, and please, let's stay the course. We know it's not easy, it's difficult for all of us, but please stay the course. And I believe we'll open it up for questions.
The first set of questions are for Mayor Breed.
Okay.
Thank you, Madam Mayor. The first question is from Alejandro Serrano, SF Chronicle. The city is woefully under the goal set by the Board of Supervisors Emergency Ordinance to lease 8,250 hotel rooms by April 26. Why did the city fail to meet this goal, and what is the city doing to meet that goal?
As I have said time and time and time and time again, there's a difference between a goal and what we all desire to do and what reality is. And in the age of social distancing, it has been way more challenging than it has ever been to serve an already challenging population. The challenges with our homeless population, in particular, issues around mental illness and substance use disorder, and getting people to just comply with some basic requests like wearing masks or staying 6 feet away from not only one another, but even the people that are trying to help, has been very difficult. And when we look at the capacity needed to build up hotel rooms in San Francisco, what we have done in the time period we've been able to do it, I think in comparison to other major big cities has been remarkable. The fact that we have in our possession over 2,000 hotel rooms where we have almost 1,000 homeless people who are housed has just been a very difficult thing to do in general. And we will continue to do everything we can to provide as many hotel rooms as we possibly can to do a couple of things. Move people out of our shelter system and thin out some of our shelters to move folks in those hotel rooms. People who are not housed but might be COVID positive, to move them in those hotel rooms. To make sure that our first responders and our healthcare workers have access to those hotel rooms as well. But we have to also do so responsibly. And so making sure that there's 24-hour staff, that there's meal delivery, that there's cleaning, that there's a checkpoint for each of these locations so that anyone can't just walk into any of these hotel rooms, that people are getting on the elevator one person at a time, that they're not in one another's rooms. I mean, the management alone of any one of these locations requires a significant number of staff. And although we've worked with a number of nonprofit agencies and people who work for the city, we've had to expand the number of people who are available to help us in this regard. I want to really take this opportunity to thank people who work for other city agencies like Muni, like the Department of Public Health, people who work for Rec and Park and the public library, people who may not traditionally work with this population, but all city workers are disaster service workers. And so they are the ones that we have had to rely on, that we have had to train, that we have had to make sure that they have personal protective equipment and the necessary resources and understanding in order to work in a different capacity than what they were hired to do. So as I've said again, over and over and over again, there's a big difference between our desires and what we want to do, because I don't think that there's anyone in the city who doesn't want to house homeless people, period, whether it's a pandemic or not. But we are in a really challenging situation at this time. So I have to be realistic. The reality is we can't do so safely without making sure that we have the people and the resources and the things necessary in place to keep the folks that we're serving safe, and the people who are actually working in these locations safe as well. It is very, very challenging. This is new territory for us. In the age of social distancing, we have to be more responsible than that.
Thank you, Madam Mayor. The next set of questions are for Dr. Grant Colfax, Department of Public Health. Dr. Colfax, your first question is from Dominic Fracassa, San Francisco Chronicle. What metrics matter most when it comes to deciding when it will be safe to begin returning to normalcy in San Francisco and in the Bay Area?
So I think there are a couple of metrics that we are looking at both within San Francisco regionally, and they are metrics that have also been suggested by experts across the country, public health experts and scientists. One of the key metrics that I mentioned was a decline, sustained decline in the number of people hospitalized. And by sustained decline, I'm talking about significant reductions over a period of 2 weeks, because that's really the 2-week period is the incubation period of the virus. So we're looking at that. We also really need to increase our testing rates at this point, and these numbers will fluctuate somewhat in terms of whether we have outbreaks and need to test a large number of people because of an outbreak. But in general, we need to increase our testing to 2 or 3 times what it currently is. So that's a key piece. We also need to ensure that our hospitals across our system maintain surge capacity to some degree, so that in the event of an outbreak, that we are able to rapidly respond. And then among the other metrics, the fourth key metric is having sufficient PPE, personal protective equipment, to be able to maintain our efforts and then to ramp them up rapidly in the event of an outbreak. Those would be some of the key metrics those are some of the key metrics that we are looking at. And then I think another key piece of this is ensuring that businesses and other entities have good data and science-driven guidelines as we relax, if and when we relax the shelter-in-place order, so that they can function in a safe way while they do their business.
Thank you, Dr. Colfax. Next question is from Trisha Thadani, SF Chronicle. Do we have the full scope of infections in San Francisco long-term care facilities if the city does not count people who have registered addresses outside of the county?
So right now, we have 123 cases of COVID-19 in our skilled nursing facilities in San Francisco. 65 of those are in Central Gardens. The county of residence is the place where the death is recorded. So if somebody has a different county of residence, but is staying at a long-term care facility in San Francisco, we would not count that as a death in San Francisco, and vice versa is also true. We have had some deaths among San Francisco residents who have been in other county facilities. I would emphasize that our largest, and if not the largest, skilled nursing facility in the country's Laguna Honda Hospital, with over 750 residents. All of those are residents of San Francisco as a requirement to be able to stay at Laguna Honda Hospital.
As a follow-up, does the city count everyone else the same way? For example, if I live in San Francisco, but my primary address is Yolo County, where would I be counted if I were to die or test positive?
So again, if deaths are counted as the county of residence, I would also, just to clarify and emphasize, that in our outbreak investigations, when we are providing number of cases, those numbers are provided regardless of whether the person has a permanent address in San Francisco or a primary residence outside of the county. They would not be counted as positive cases on our data tracker. They would not be counted as a San Francisco case if they maintained a primary residence in another county or jurisdiction.
Next question.
And just to add again, that's basic data rules across the state, so we are adhering to those principles.
Thank you, Dr. Colfax. The next question is from Gerald Chin, SF Bay. What criteria did the city use on deciding to close John F. Kennedy Drive in Golden Gate Park and John F. Shelley Drive?
So I think it's really the criteria that we've used consistently across this response, really ensuring that people had the education and the tools they need to keep themselves and others safe, a recognition that social distancing when one is outside, and the need to improve your mental and physical health to go outside in a city as dense as San Francisco. We need more open space for people to be able to do that. Obviously, we continue to, well, I shouldn't say obviously, we continue to strongly recommend wearing masks, even if you're able to socially distance 6 feet or more. But really, we felt that the public had the tools and education that they needed in order to socially distance responsibly and to wear face masks responsibly when they're outside. And that was the reason we felt that it was time to open this space to the public.
Next question is from Ron Lin, LA Times. The number of new cases are starting to decline in the 9-county Bay Area, but week-over-week deaths are not. And as you mentioned, the number of hospitalized people has been flat. Why are we not making more progress in reducing deaths and hospitalizations?
So overall, the deaths in San Francisco have, while one death is too many, we have had relatively lower number of deaths than many other regions in the country, and I'm thankful for that. One of the key issues is that the deaths lag the cases to some degree. So over the course of the illness, it can take, unfortunately, it can take weeks for people suffering from the illness to require more intensive care, and then, unfortunately, in some cases, to die. So the number of positive cases, the number of hospitalizations will be consistently less, they will be consistently behind the deaths will be consistently behind the hospitalizations and increase in number of cases. So it's really a matter of the pattern of the disease. I think what is also important is that the hospitalization rate has stayed relatively stable over the past 2 weeks, which is a positive sign in the as we find more positive cases. Now, obviously, the more we test, the more cases we will find, which is why it's so important to look at that hospitalization rate over the next 2 to 4 weeks, with a hope that curve will decline. Deaths, I think, will continue to increase over the next 2 to 4 weeks, just because of that delay in when we see deaths over the course of the disease.
Next question is from Christian Cafton, KTVU. What are the criteria by which the San Francisco Department of Public Health and other departments of public health across the Bay Area are using to determine whether to extend and when to lift the newly extended order? Could we see a further extension?
So I think, what I focus on is what the new normal will be, and I can't say when that new normal will be. I do think that we need to, again, see some of the changes in the data that I've talked about today, the reduction in people living with COVID-19, the increase in testing, our ability to monitor the epidemic and get adequate PPE. So I think we just have to iterate. This situation has been fluid for weeks and months now, and we just need to keep following the data and science, while also ensuring that we're developing guidelines for what the new normal will look like. I think for the foreseeable future, high adherence to wearing masks and other facial coverings in public, ensuring that people social distance whenever possible. Those are going to be very important criteria moving forward. And then again, we need to become more granular and work with the business community and other key stakeholders to figure out, based on the data and science, what guidelines need to look like as we potentially loosen the shelter-in-place order in the coming months.
Thank you, Dr. Colfax. The next set of questions are for Director Abigail Stewart-Kahn, Homelessness and Supportive Housing. Okay, Director Stewart-Kahn, your question is from Mike Linden, Fox News. Previously, you've talked about the challenges of keeping unsheltered individuals in hotel rooms for 14 days, especially if they don't want to. What are you doing to make sure they stay in there for the allotted time? Are there incentives being offered?
Thanks for that question, Mike. I think you all heard the mayor speak about the challenges of staffing hotels across the board. The 14 days would be specifically related to somebody's medical need to isolate and quarantine. Many individuals in our hotels are staying for longer than that, and certainly there are challenges. I think about this myself. If I was told to go to a hotel room and not leave for a long period of time, how challenging it would be for me. And then if you add on the complexities of somebody who hasn't been living indoors, somebody with a mental health or trauma background, someone with a substance use issue. Certainly we know that these compounding layers of trauma, medical, and behavioral health needs make it difficult, on top of it just being difficult for any of us to stay in one place for that long. We've been having really tremendous success as we get better and better at operating hotels, and we know from operating permanent supportive housing across the country that people want to be housed and they want to be safe. And if you can meet their needs with food and comfortable spaces to be and enough information and contact, people will absolutely kind of connect to where they are. I think part of the challenge in our hotels is that we can't connect. And so things that we know that are really successful in permanent supportive housing, meals together and events at Christmas time and other holidays can't happen. And so what we're doing, to answer your question, is meals are being served 3 times a day, of course. We have people calling in to check on people by phone, and increasingly we're really looking forward, we've been piloting and we're looking forward to rolling out a really big volunteer program where you can be kind of a buddy to somebody staying in a hotel, and so you can form a really tight connection by phone. So we know that people have things to do. People have access generally to television and to food and to a comfortable place to be. And we mostly get stories of people who are so grateful to be there, and their only question is, will they be able to stay in place for the entirety of the pandemic, and what will happen to them afterwards? And so while there are a few exceptions and it's so much work to help people stay there for the period of time, we are getting much better at it. And we thank all of our guests, and we thank, as the mayor did, we thank the DSWs and the HSH providers and HSH staff who are out there every day operating these hotels. I was told that the head of the public library is deployed as a site monitor at one of these hotels. This is incredible. And so together we can really, it's really, really hard to do for everybody. I don't want to sugarcoat this. This is the hardest thing San Francisco's ever had to do across the board, and these hotels are part of that challenge. And generally, we're hearing and learning together how to make this work.
Thank you, Director. That concludes our questions for today. Thank you.